Okay, so first off, thank you so much, Dr. Tartaglia, for coming on to the show. Really appreciate it. You, I think, are kind of a hidden gem in the Northwest Valley right now with what you're doing. And I wanted to get you on just to talk a little bit, get people to have a chance to get to know you a little bit better. Because as you know, in medicine, you have a problem. You don't know your doctor until you need a doctor, and then you don't know who to go to. So I'm hoping that this will help some people out in our community specifically make some more informed decisions when it comes to their healthcare providers. So thanks for coming on.
Well, thank you, Corey, for having me.
Absolutely. So let's start with some background info.
Okay.
What got you interested in medicine, and what made you kind of choose that as a career?
So I'm one of those weird kids that's in seventh grade that said they were going to be a doctor and just did it.
Oh, wow.
I don't know. I mean, there's something about, I mean, math and science and school always kind of came easy for me. So as I kind of got into high school, I was just lucky, I guess. And then when I got into college, that's where I kind of wavered a little bit because most doctors pre-med or biology and biochemistry, and I was like, okay, this isn't for me. So I went a little bit different route. So in undergrad, I got my undergrad in nutritional sciences, and then went to become a registered dietitian. So my route was a little bit different. And then I decided after that that I actually wanted to become a registered dietitian. So I moved to Reno, Nevada, did an internship,
Wow.
and then became certified, and then worked for Mayo Clinic as a clinical inpatient dietitian for a year prior to going into med school. In many ways, it actually really helped me kind of realize what I wanted to do, which was not inpatient. I knew I wanted to be an outpatient doctor, so that helped a lot. And it really just formulated like, I love this, like this is what I want to do. So my route was different, but in many ways, I think it formed me, and it helped me really, one, for med school, and it helped me figure out a little bit what I wanted to do before I actually got started.
That's awesome. And then, so you were practicing in family medicine for quite some time before this transition, right?
Yep. So I've been in private, kind of traditional family practice for 13 years now.
Okay. And what kind of drew you to that, and then ultimately kind of transitioning to direct primary care practice that you've opened now?
Yeah, so I've been super fortunate. I'm one of the few that kind of right out of residency found a wonderful practice. So I practiced on 59th and Union Hills for the last 13 years. And family practice, in many ways, we're kind of like the jack of all trades, right? So we kind of joke that we go from birth to grave, which we really do. So we don't go inpatient, at least I don't anymore. But I see babies. We do all baby immunizations and well checks, and then we see kind of everything in between, and then we help people kind of with their end stages of life. So that is what I love about my job, is I really get to kind of be in the thick, in the trenches with patients. I know their ups, their downs, and I love that. And I love being able to see the multi-generational. And now that I've been practicing so long, I've seen these babies that I've taken care of, from babies, and now they're 13. I'm like, oh my gosh, how did that happen? So I love watching my patients grow and helping them through that. So we're really lucky in family practice that I get to do a little bit of everything.
Yeah, that's awesome. And then, so in regards to kind of what you're doing now with your direct primary care practice, how would you describe what you do? And then how would you maybe differentiate what you're doing now with that practice as opposed to maybe more traditional family medicine?
So traditional, where I've been is traditional medicine, which means when you come in, we use your insurance, we bill out the office visit to your insurance, kind of like what everybody is accustomed to. But I'm sure a lot of people listening have experienced kind of some of that frustration, as with many different things in life, it's become more impersonal, right? And so doctors become super unaccessible, right? Which means it takes weeks to get to see me. If you're sick, you rarely ever get to see me unless I have a cancellation. And my clinic is always super packed, right? So 15-minute visits. And I've been doing it for a while, so I'm good at it. But what I realized was it just wasn't lighting my fire. Like, I just wanted more of a relationship with patients, and wanted more time. And I just knew there's no way in this model it was going to change. It's just not going to change, truthfully. And I've only seen the progression getting worse. So I knew I wanted to do something different. And when I kind of came across this model, I was like, this is me. Like, this is what I want to do. So direct primary care is a membership-based model. So if, kind of, if a lot of people listening would just understand it like as your gym membership. So it's a monthly membership. So my membership is $89 a month and $29 for kids. And basically when you come see me, you get me. It's just me and one staff, and I want to keep it that way. So I wanted to keep it super small. When you come see me, I'm not billing your insurance, meaning you don't have to pay a copay. So what does that allow you? Well, every visit with me right now is an hour. So we might not use the whole hour, but I have the whole hour, which is, I can do so much in an hour. It's just amazing. And I can really dive down to more of the root of the problem versus what I think a lot of us do, unfortunately, because we don't have a lot of time, is more of the band-aids. And that in family practice is not really where I think we should focus our energy. So I think with this model, it really just opens up, I've attracted all sorts, I guess I'll put it that way. So I've attracted people with regular insurance that are super just frustrated with the model, and they want a relationship with their doctor, which I think is what I'm offering in this kind of practice. A lot of people are transitioning to super high deductible with health savings accounts. And now, really that access is a lot easier for me. And then I've also attracted people that don't have insurance or health savings. I'm not health, sorry about that, but health share plans, right? Which is your major medical plans. And in many ways, those high deductible and health share plans really marry well with what I do, because for $89, you essentially have unlimited access to me.
Yeah, that's awesome. And it makes a lot of sense having, especially for family medicine, having that relationship with your doctor. Because like you said, from birth to grave, potentially, that's a pretty powerful thing. You really get to know your patients pretty well.
Mm-hmm. I do.
Let me ask you from this perspective, for people sitting at home, they're YouTubing or Googling maybe some health concerns or issues they're having, looking for a solution. Kind of going to ask you a two-part question. What's the most common individual or condition or thing you see on a daily basis in your practice? And then B, who really is the person that should be seeing you, even though they may not know that?
Yeah. So, I would say for family practice, my bread and butter is a lot of chronic conditions, right? So hypertension, diabetes are probably two of the big ones.
Yep.
And, the musculoskeletal complaints are high on the list, lower back pain, knee pain. So those are kind of the top three, I guess, off the top of my head is what I would say. But part of that, when you look at diabetes, for example, right, it's linked to obesity often, right? Not all the time, but often linked to obesity. And really that's where we miss the boat, right? So as doctors, I can give you medicine, I can give you insulin. It's super easy. Honestly, I know how to do that really well, but I don't want to, right? But the root of the problem is, what are you putting in your body? Like, are you moving your body? What are you fueling your body with? And why aren't you doing it the right way? And so those are the problems that take a lot of energy and time, right? So is it a time management issue? Is it, I don't know how to cook? Is it, I don't like broccoli? Like, where does the problem lie? And then we can focus on trying to fix that and really take it in small chunks, which again boils down to, I can now see my patients more often. So whether we do weekly weight checks, whether you text me, hey, tell me what you struggled with this week. So having access to me and that accountability, I think, is key. I mean, accountability, if you think about the root of a lot of things, right? That's why AA works. There's accountability. That's why Weight Watchers works, because there's some accountability. Well, I can function in this model as people's accountability to a lot of different things. So that piece is super exciting for me. And I think people don't think about their doctor that way. So to your second part of your question, I really think it's, I feel like there's so many untapped people that really should be seeing the doctor that aren't, because they say they're healthy. How do you know that? Have you had a blood test? What's your family history look like? Like, what does this next year look like in your health? Like, what are your health goals? Like, we think about our financial goals or other things, like we forward think about that, but we don't do that with our health. Well, why? I don't know. We just kind of wing it. Well, that's fine maybe in your younger years, but as you approach, 30s and 40s and 50s, the different decades of life bring different things. And that's where having that relationship with the doctor and kind of looking at like, what are some of your health goals this year, right? And nobody has the time to do that. And I love doing those kind of things.
That's awesome. Yeah, no, I love that. You kind of alluded to this with one of your answers a little bit ago, but one of the biggest barriers my patients have specifically is they develop a problem, the problem's persisting for a while, they're getting frustrated, and it's not getting better on its own. So finally decide they're going to do something about it. They call an office, and it's 3 months before they can get in. Mm-hmm. So on average, what would you say, like kind of time frame wise, if someone reaches out to your office, how long from then till they're in the office talking with you?
A couple of days, just depending on, the time of day you call and the week.
Yeah.
Now, the only difference, like if you were to think of one of the things in this model I don't want to be is urgent care, right? Mm-hmm. So part of family practice is developing that relationship. So in my model, there's no commitment, meaning it is month to month, right? So you can really cancel anytime. I mean, I don't want people, I'm not doing a year contract because I don't want people not to want to be there, right? So I want people that want that relationship and that want me and that like what I'm offering. So I'm not doing kind of a commitment. It is month to month, but I also don't, I kind of tell people at the beginning, I mean, I guess you could use me for a month, fix your knee pain, and then you can go on your merry way. But that's not my ultimate goal with this. And I think people, as long as I explain that to people, I think people understand that. But really, other than using urgent care, having a primary care doc to be able to order some physical therapy, order an MRI, you're not going to get that at urgent care, right? They're going to give you some naproxen and tell you to go see a PCP, right? And that's where I can really help, right? Because I can do the referrals, I can start the workup, even if I have to get you to PT or ortho. I have a lot of connections. I know who I like, I know who's good, I know who I wouldn't send you to. I know how to get you the MRI. And as far as like using your insurance, like if you have insurance and we're going to order an MRI, for example, of your knee, we can use your insurance. Simon Med or Banner or Solus, whoever we send you can still use your insurance. So it's not that we never look at your insurance or we never use your insurance. It's just insurance doesn't cover the monthly membership, but all the wraparound stuff that we would typically do, like for example, labs, we can still use your insurance if you have traditional insurance that would cover it.
Yeah, perfect. And that kind of, you really already kind of partly answered this question, but I was going to ask you, like, what would you say is your criteria if you're talking to your mom, your dad, your brother, your sister, your husband? Truthfully, like, what is the criteria for them to come to you as opposed to maybe that urgent care or another healthcare provider in general?
Well, truthfully, like in the West Valley, or even in the Northwest Valley, I mean, there are doctors, but there's not a ton of us. And truthfully, there's not a lot of females. And so that's, not that I just treat females because I treat males too. I mean, I obviously treat the whole spectrum, but I mean, I definitely attract a larger female population because there's something, females tend to relate to other females. I'm a mom, so I tend to attract a lot of moms because again, we can relate. So that piece is actually really nice. But I think kind of what I said before, which is access to care now is getting super complicated. And I think I really wanted, one of the things that were super important as I kind of looked at my goals and missions for this was I wanted that kind of small town feel, right? That family, small town doc feel. And that's one of the reasons why I chose my location. It was fairly close to my previous practice. Number one, it's where I'm raising my family, right? So it's near where my kids go to school. It's near where I live. It's near where I go to church. It's near where I go to the gym, right? So I wanted to stay in my local community so I could be that community doctor for people. I want to run into people at the grocery store. Like I want to be approachable. I love that piece of it. And so I think, and the other thing is I wanted people to know my staff, right? I have Christy, who's amazing. When you call, you're going to get her, right? Not a phone tree. And she's going to know you, you're going to know her, she'll know your voice. And that piece is lost. Like that is lost in not just medicine, but a lot of industries, is that personal touch. So I think that's what I kind of wanted to bring back.
That's awesome. I love it. What are some of the other services you provide at your office? I know you guys got a lot of stuff you can do out of there.
Yeah, so I'm really just at the beginning of kind of this journey, and that's so exciting. Like, I'm really struggling with wanting to do absolutely everything. So I really think as I evolve in, 6 months, a year, I'll be able to really offer some really cool breadth of services. But right now, I do women's health, so I can do pap smears, I can do joint injections. I love dermatology, so skin checks and mole removals. Um, I can do cupping for musculoskeletal stuff. What else? Just trying to think. I do things like for asthma or people that are sick, we can do SVN treatments, cryotherapy. Oh gosh, we're doing labs in the office, so that's super convenient. So that saves you a step going into a big lab and getting your labs drawn. We can draw labs there. Shortly in the next couple of weeks, I'll be offering prescriptions at the office too. So if you come in for lower back pain, you can leave with some anti-inflammatories and a muscle relaxer, so you don't have to stop at Walgreens when your back is hurting really bad, or when you have a sinus infection. If you can leave with antibiotics, that's super convenient too. So those are just a few things.
Yeah, that's awesome. And that's huge, being able to do all of those things in one visit. No special trips, no other kind of distances need to be traveled by patients. That's huge. So
Yeah.
Thank you so much for your time. What I'll
Thank
do, like
you.
I said, is I'll put your contact info in the description below as well.
Okay.
Is the best way to kind of for people to reach you just calling the office? Is that the best way for them to go about it, or?
So, I think it just depends. Yes, if you call, Christy will answer the phone and she can help you and answer questions. My website is super thorough, so you can just find me. I kept my name, so I'm Dr. Tartaglia. I kept my name, so it's just Tartaglia Family Medicine. So if you Google that, you can find me really easily. And the website has a lot of answers to a lot of basic questions. But yes, I definitely want people to reach out. And if they want to enroll, they can do it online. They can also just call Christy and she can help them through that process.
Awesome. Anything else you would like to add?
No, I'm just super excited to be working with, the local community. I'm super excited to do this. Like, I love getting to know kind of my local community. That's why I was excited to meet you.
Yeah, absolutely. Moved here April of 19 to the kind of this Upper West Side, and it has been best decision we've made since moving to Arizona from Illinois. Awesome community feel, kind of likewise to you. I think I live 5 minutes away from the office, and it's been really fun getting to know the area, not only kind of the community, the residents, but the local providers in the area has been awesome. So, but thank you
Wonderful.
again.